Medicare for All taking center stage on Capitol Hill yesterday as the House held its first hearing on the issue the Republicans and Democrats remain at odds over. Watch some of this.
Not to advance forward to adopt a Medicare for All system is to deny, I think, the common humanity of our fellow citizens.
This bill is a socialist proposal that threatens freedom of choice and would allow Washington to impose one-size-fits-all plans on the American people.
There would be no choice. So what would it cost Americans to make that Medicare for All bill a reality? Our next guest takes a look at the numbers in his upcoming book. It's called The Case Against Single Payer. Chris Jacobs is the CEO of Juniper Research Group down in D.C. He joins us here in New York. Good morning to you. Good day.
Thanks for having me.
All right. First up, just so people understand, when they hear Medicare for All, that sounds great because it's like it's free health care for everybody, right? I mean, that message is pretty effective.
Well, the old saying is, if you think health care is expensive now, just wait till it's free. and you're going to end up paying for it in tax dollars and higher taxes, and it will encourage people to overconsume health care.
All right, so let's take a look at some of the numbers. The first number is 71% of Americans would pay more under single-payer health care. Explain how that works, because I've heard nobody would, you're not going to pay premiums anymore or any of those other things.
Right. The problem is you're going to have to pay more in taxes. Right? Bernie Sanders proposed a 4 percentage point increase in income taxes and a 7.5% increase in payroll taxes. Dr. Kenneth Thorpe, when he did this analysis in 2016, said it's not 11.5 percentage points, it's 20 percentage points of income. So if you're paying 20% of your taxes in, double it. Okay, you're not going to end up making money on that. You're going to end up losing money. 2/3 of the American people.
Speaking of losing jobs, you say the statistics are that 1.5 million people who work in hospitals would actually lose their job. Explain that.
Yeah, basically the single payer would, quote, save money by paying hospitals less. Medicare, the current Medicare program, 80% of hospitals incur a loss on their Medicare patients. If they don't have private insurance to cover that gap, they're going to cover hundreds of billions of dollars of losses. They're going to have to lay off workers. You do this in one fell swoop, this could cause a recession just on its own.
Okay, when people hear Medicare for All, they think, okay, it's a very efficient program that helps a lot of people. But according to the experts, the GAO says that there was pretty much $85 billion worth of fraud involved.
Right, fraud
and improper payments.
Improper payments. You compare that. That's Bernie Sanders tries to criticize insurer profits. Insurer profits last year were $21 billion, 1/4 of this number. Okay, why?
That's a big number.
Because insurers have an incentive to make sure scammers aren't running away with money. We had in 1 week last month. $2 billion fraud cases against Medicare. This is the problem. And if you expand the program, you'll create more incentive for fraud.
Ultimately, it would cost $32 trillion, is a conservative estimate, over 10 years. So that means it would cost $3.2 trillion a year.
Right. And that's the Urban Institute, which is liberal, the Mercatus Center, which is conservative libertarian. There's a bipartisan consensus about the cost of this. This is actually an underestimate. Bernie Sanders and Jayapal in the House have proposed more benefits for their single-payer version this year. This could be a lowball number.
Okay, well, thanks for working the numbers for us.
Sure thing.
Thank you very much.